What's going on, guys? Josh here, back with a video on ordering lab tests on a budget. In my last video on lab testing, I covered how you can order lab tests online, the websites you can use, and the process of getting the labs done without visiting a doctor's office. In this video, I'm going to cover some of the tests I think everyone should be getting at different times throughout the year. I'll provide a list of tests along with the reasons I recommend them at those intervals. Also, I will include the estimated out-of-pocket costs should you choose to buy these on your own with the use of an online service. For example, in the event your doctor decides not to order the test for you, or if there are concerns about insurance costs. Keep in mind, many doctors will not agree with these recommendations and find them to be unnecessary, costly, and hypochondriacal, which is basically just fancy speak for being a wuss, but we don't care about that here. Of course, if you want to be an active participant in your own health, you're going to have to do some things that our current healthcare system deems to be unusual or even wasteful. Before I begin, be sure to subscribe to the channel, like the video, and leave a comment at the end if you find the video helpful. Also, if you want to check out the video on how to order your own lab tests online, check out the video link. I'll include it somewhere on the screen or in the description. Let's start with lab tests I think everyone should get 3 to 4 times a year, if affordable. This is not a complete list of everything I think you could do, but some very helpful basics that I think everyone should get 4 times a year, provide you with a lot of information for relatively low costs. And these are tests that your doctor may be willing to work with you on with very little pressure applied. So the 5 tests are CBC, Complete Metabolic Panel, Lipids Panel, Insulin, and Highly Sensitive C-reactive protein. A CBC is a complete blood count. This is a count and analysis of several important types of cells in your blood, namely different types of white blood cells, as well as a count and size/content analysis of your red blood cells. When you are sick, your total white blood cell count may go up, and if very sick or fighting off major infections, may go above the normal range. When you're immunocompromised, it may go down below normal range. Your red blood cell count, when you're anemic, your red blood cell may shrink in size. Analysis will enable your doctor to provide a correct diagnosis. Other items here include platelets, which assist in blood clotting. In certain types of cancers, as well as in other disorders, platelets can dip below range, causing issues with clotting. A CMP, or Complete Metabolic Panel, is a list of metabolic markers that indicate the state of your metabolism. This includes your fasting glucose levels of different electrolytes found in the body, such as sodium, chloride, potassium, and calcium. Also included in the CMP are ALT and AST, which are very important liver enzymes, which when elevated can indicate infection or moderate to severe kidney issues, to reactions to different types of compounds or supplements, and the most severe being liver failure. A CBC and a CMP together is about $45 out of pocket. A lipid panel is, of course, a count of your cholesterol levels, including total cholesterol, and then breakdowns of that total into various types of cholesterol. There is high density, considered to be protective, low density cholesterol, considered to be harmful when elevated or high, very low density in cholesterol, which is considered to be harmful or dangerous, and triglycerides, which is protective at a normal or optimal range but can be damaging as well if too elevated. Lipid panel generally runs about $28 out of pocket online. Fasted insulin is something that most people will be familiar with. Insulin is a hormone that is created by the pancreas, which is produced in response to free glucose in the body from the food that you eat. Insulin will bind to and transport that free glucose from your food for either energy production or storage in fat cells or as fat around your organs. Fasted insulin is a very important marker in managing and tracking pre-diabetic states as well as diabetes. This is important to get because knowing your insulin levels long before you are diabetic will help you prevent getting type 2 diabetes in the first place. I don't think anybody here wants to get type 2 diabetes, just my assumption. You will also be able to make adjustments to your lifestyle and diet based on this information and help prevent that diabetes. A fasted insulin test costs about $50 out of pocket online. Lastly, High sensitivity C-reactive protein is a marker for a protein that, when elevated, indicates inflammation in the body. It is highly sensitive, meaning it can pick up even low levels of inflammation. As we know, inflammation is a key driver of many, if not the majority of, disease states. So keeping track of this will help you to mitigate possible future disease, as well as make lifestyle and dietary adjustments to keep your inflammation down and your health up. High sensitivity C-reactive protein is about $48 out of pocket online. I recommend all of these once a quarter or 4 times a year because they are generally fairly affordable, cover the broad basics of health in many different areas, including blood cell counts and metabolism from a variety of angles. And you have a good chance of having a doctor cooperate in getting these for you. If the doctor doesn't want to get you a script for this more than once or twice a year, you can always buy it yourself online. Or even if they say yes to, let's say, a complete blood count and a metabolic panel and lipids, but no to insulin, you can take a free market approach and buy the ones that they want to help you with yourself. Altogether, out of pocket, these tests I recommend would cost about $170 every 3 to 4 months. For the next test, these ones I'm recommending 2 times a year. The reasoning for 2 times a year instead of 4 times a year is because they are possibly a little bit more expensive, but more so the data takes a while to change, and provided there is nothing out of the ordinary with the results, can generally be left alone. But 2 times a year is still good to keep baseline metrics for these. So we have thyroid hormones, iron and iron storage and binding capacity, B12 levels, and vitamin D levels. So for your thyroid hormones, this includes TSH, free T3, free T4, and reverse T3. Your thyroid is the gland in your neck that is responsible for your body maintaining its metabolic rate and burning energy. There are a few different hormones or different phases of hormones that are released here. TSH is the one that most endocrinologists will refer to, and it's considered a catch-all marker, which is actually secreted by the pituitary. It's called thyroid stimulating hormone, and it does pretty much exactly what it sounds like. It stimulates the thyroid to release those thyroid hormones. Most doctors will use TSH to get a baseline of what's going on with the thyroid itself, as TSH levels will go up and down according to the rate at which the body requires or is producing the thyroid hormones, known as T3 and T4. This is considered what's called negative feedback. Free T3 and free T4 are what are primarily of interest here, since your total T3 and T4 include bound or non-bioavailable thyroid hormone. If the body is not producing enough thyroid hormone, TSH will be elevated, and if it is producing too much thyroid hormone, it will be lower. These two states are called hypo and hyperthyroidism, respectively. So, high TSH, hypothyroid, meaning your body's trying to pump up the thyroid hormone. Hyperthyroid, low TSH, meaning your body's trying to reduce the amount of thyroid hormone. Clinical hypothyroidism is called Hashimoto's disease, which is fairly common, especially amongst women. And clinical hyperthyroidism is called Graves' disease, which is a bit more common between the two genders, but still primarily seen in women. TSH alone is about $38 out of pocket online, and a panel including TSH and the other markers I mentioned might cost between $140 and $170. Next, iron levels, storage, and binding capacity. Of course, most people will have heard of iron. If you are deficient in iron, then you will be anemic. Ferretin, whereas ferritin is a form of stored iron, and total binding iron capacity is the capacity you have to bind iron. Iron is about $25 out of pocket online. Iron and binding capacity together is about $29. And ferritin, a stored form of iron, is about $29 online out of pocket. Panels are available with all three for about $90. B12. B12 is one of several important B vitamins that many people in the West, particularly in the United States, because we do so many things well here at the moment, are deficient in. Fixes for low B12 are cyanocobalamin or methylcobalamin supplements, although many people have trouble with the methylation cycle, so methylcobalamin would be preferred. Weekly B12 injections from a licensed doctor in the short term, and you can also get B12 from foods. B12 has a very wide reference range, but you should ideally be at least 500 at a minimum and up to 800 or 1,000. It all depends on how you feel. A B12 test is about $33 online out of pocket. Keep in mind the test most labs offer typically measures cyanocobalamin, which is the unmethylated version, so make sure you know what type of B12 supplement you're taking. If you're taking methylcobalamin, but you're testing cyanocobalamin, you may not see those numbers reflected. Let's see. Vitamin D, the storage form 25OH, is of course another vitamin in the body that is synthesized as a result of sun exposure, but also may be present in certain types of food. Again, many people in the United States are deeply deficient in vitamin D. If you are below 50 nanograms per vitamin D, you should supplement with vitamin D supplements, and depending on your complexion and genetics, you could potentially spend a bit more time in the sun. Personally, I burn super easy and have minor genetic predispositions to skin cancer, so I try to minimize spending too much time in the sun without sunscreen. I think you guys can tell that by my complexion. The vitamin D 25OH test is typically about $48 online out of pocket. Make sure you're getting the 25-hydroxy form of the test, which is the storage form of vitamin D, and keep in mind many recommend supplementing vitamin D3 with K2. They usually come in a supplement bottle as a pair, vitamin D3 and K2, as they work synergistically together if you need to supplement vitamin D. All of these tests I just mentioned for the every 6 months would cost about $313 every 6 months. Lastly, we have the tests I recommend once a year: a Cardio IQ panel from Quest Labs, total and free testosterone and E2 estradiol, as well as hemoglobin A1C. The Cardio IQ panel, of particular interest for those with cholesterol issues, family history of heart disease or high blood pressure. The Cardio IQ provides a detailed breakdown of the size and quantity of the various cholesterol molecules in your bloodstream. It's not just LDL versus HDL, which a lot of doctors tend to look at, but the size of those particles that is also important. Your regular HMO doctor or PCP may not necessarily go for this one, but given any family or personal history, I think there's a good chance that they will. If not, you can buy it on a website like Walk-In Lab for about $120 to $130, a worthy investment to make once a year, in my opinion, especially if you have a family or personal history of heart disease. Next, total and free testosterone and E2 estradiol. For men, total and free testosterone is very important, but unless you have levels below, let's say, 450 nanograms per deciliter for total testosterone, you can do this once a year. I do recommend the first year that you consider doing these labs 2 to 3 times a year, the total and free testosterone plus E2, and do it at peak production in the morning after waking up. The reason for this is it will help you get a good baseline for that year, and then once you've tweaked the variables that might cause your testosterone to go up or down, you can put it on autopilot and consider doing it every 6 months or once a year. Of course, if you're really into it, you can do it every quarter. E2 is one of the primary active forms of estrogen, which is important for both men and women as a neuroprotective and cardioprotective hormone that performs a variety of tasks within the body. Especially important for women, but estrogen levels should also be at a certain point for men as well. For men, you're going to want to look at maybe 20 to 30 nanograms per deciliter. I think I have the units right on that. Side note, if you are a man and you end up having a total test level below 300 nanograms per deciliter, you may need to look at changing your diet, removing plastics from your environment and foods, and getting much better sleep, and also get into lifting weights. If those things don't fix it, then you may need to explore testosterone replacement therapy. If you do get TRT, be sure to speak to a qualified, and I do mean qualified, endocrinologist, and get a second opinion from a lab or health company that is on the leading edge of hormone replacement. The reason for this is, even if a doctor does offer testosterone or hormone replacement therapy, the protocols may be out of date, not based on the latest anecdotal experiences, and they may not be taking into account things like circadian rhythm. They may be doing one massive dose per week and sort of letting your T levels run down throughout the week in a very unnatural way. Or they may even, some places in Asia I hear they do once a month, which is insane. So make sure you're speaking to somebody who knows what they're doing. So some labs might include Merrick Health. I think that's Derek, more plates, more dates. Be sure that you don't just start whatever protocol you're given without looking into the details. From what I've heard, 3 to 4 times a week is good, and you want to split the amount of whatever total testosterone you're getting into those injections. So that might be something like, and again, this is not advice. It might be like somewhere between 60 to 80 micrograms of test throughout those days, and you're going to split that amount between those injections. Lastly, for testosterone and E2, estrogen, you're going to want a test that lists LC-MS-MS as the methodology, or liquid chromatography mass spectrometry. You guys don't need to know about that, but LC-MS-MS, that's what you're looking for the method. I know for sure for total and free testosterone might cost about $70 out of pocket online. E2, LC-MS-MS might cost $33 online out of pocket, and that one I know for sure is available on discountedlabs.com. Lastly, hemoglobin A1C. So you're going to want to do this once to check out your levels. If you end up having a high hemoglobin A1C, you're going to want to do it 2 to 4 or more times per year. If your doctor, and especially if your doctor has let you know you're pre-diabetic or diabetic. Hemoglobin A1C checks to see how much glucose remains attached to your red blood cells over a long period of time. And the higher your A1C, the more glucose your red blood cells are holding. A high A1C is a hallmark of diabetes. Ideally, you want an A1C level of 5 or slightly below that, maybe 4.7, 4.8, 4.9. And the A1C test is about $30 online out of pocket from walkinlab.com. So all of those tests together recommended once a year, possibly more depending on your needs, but at least once a year would cost about $260 one time. The next section, we're going to talk about bonus tests that you can get if your other tests meet certain parameters. And then I'm going to talk about the final total out-of-pocket cost for everything I'm recommending, because I want to keep things totally transparent with you guys. Bonus tests for TSH, I mentioned in the twice a year category. TSH is part of the thyroid panel. If your TSH is above 4, you're going to want to get an antibodies panel for your thyroid. So that's thyroid globulin antibodies and thyroid peroxidase antibodies. These are tests to rule out autoimmune antibodies in the case of possible hypothyroidism. Subclinical hypothyroidism, you'll see at a TSH of 3, 4, 5, something like that. True hypothyroidism will have a very high TSH of like 14, 30, 55, maybe even 100. Tests are included in a thyroid panel on Walk-In Lab for about $160 total, including the free T3 and free T4, or $80 together for the 2 types of antibodies without the rest of the panel. Next, iodine and selenium, also related to the thyroid. These are crucial components of thyroid hormone synthesis. If you have elevated TSH, your thyroid may be struggling to make the T4 and T3, those primary thyroid hormones, and this could be due to low iodine and selenium, because those are key ingredients of thyroid hormone synthesis. Iodine is $87 online out of pocket on Walk-In Lab, a bit more expensive for an individual test. Selenium is $98 on Walk-In Lab, also more expensive for an individual test. If your free testosterone is low, remember we mentioned free testosterone, you're going to want to get your albumin and your sex hormone binding globulin checked out. Albumin and sex hormone binding globulin are the 2 main methods of binding testosterone, meaning that testosterone is not bioavailable for use in different places around the body. This could be genetic. Some people have high sex hormone binding globulin, for example, or they just have very strong albumin, but it's important to know about. So a knowledgeable endocrinologist or health clinic that knows their stuff would be able to fill you in on this if needed. Albumin is actually included in complete blood counts, so no extra cost on this one if you're following these recommendations. Sex hormone binding globulin is $50 on Walk-In Lab, out of pocket online. Lastly, if you're interested in having kids, if you have any concerns about having or trying to have kids, you're going to want to include luteinizing hormone, or LH, and follicle stimulating hormone, or FSH. This is part of the hypothalamic pituitary gonadal axis, meaning basically it signals from the hypothalamus to the pituitary to your gonads, in the case of men to create a sperm. I believe in the case of females it has to do with ovulation or ovaries. So these 2 are $60 together on Walk-In Lab. and both relevant tests for either gender in the case of trying to have kids. In conclusion, I think the panels provided here in this video provides you an excellent look on your overall health. Using the announcer voice. If you are not sure where to start with lab testing, but want to take your health into your own hands, this will be the list that scratches that itch for you. The total cost of these recommendations, solely out of pocket, would be about $1,570. Personally, I think your health is worth it, and this is less than a bill you would get from your insurance company for even half these tests if they ever decided not to cover them. Again, as mentioned, you should try to get tests covered first through your healthcare provider, and then if they say no or advise against it for health insurance reasons, you can buy whatever they don't say yes to online. Online test purchasing is also a good option if you're impatient like me and don't want to wait for a doctor's appointment. I hate the organizing, I hate the attending, and I hate the asking for things. So I like to order mine online. Of course, I do get tests done by the doctor as well, but sometimes I don't want to wait. My personal view, the time for the medical system to gatekeep health data is over, so you should absolutely consider getting involved in your own health and getting labs done regularly. The best medicine is prevention, not cure. Somebody tell that to the CDC. Alrighty guys, that's it for this one. If the video provided you with a ton of value, please go ahead and hit the subscribe button, like the video, leave a comment, and smash that notification bell. I'll see you in the next one.